Did you know that over 50% of people around the world self-medicate without ever consulting a doctor? Even more shocking, every year, thousands of individuals end up in emergency rooms due to complications from drugs they took without any medical guidance. Self-medication might seem harmless, popping a pill for a headache or taking an antibiotic left over from last year's cold, but the truth is, it can be dangerous, even deadly. And the scariest part? Most people don't even realize the risk until it's too late. Let's face it. We've all done it at some point, reached for a painkiller, an antacid, or a leftover antibiotic because we didn't feel like booking a doctor's appointment or waiting in line at the clinic. In today's fast-paced world, self-medication feels like a convenient solution. But what happens when this convenience spirals into a risky habit? Self-medication refers to the act of taking drugs or treatments to treat self-diagnosed conditions without the advice or prescription of a medical professional. While it may seem efficient or harmless in the moment, self-medicating can mask serious health conditions, lead to incorrect dosing, dangerous drug interactions, or worse, permanent damage to your organs. Today, we're going to break down the most alarming self-medication mistakes people make, the real-life consequences of these actions, and most importantly, how to protect yourself and your loved ones from making these life-threatening errors. Why do so many people fall into the trap of self-medication? The reasons vary. Some think they know their body. Others want to avoid long waits at hospitals or can't afford a doctor visit. And then there's Google, our modern-day doctor, available 24/7, feeding us articles, videos, and forums that make it dangerously easy to diagnose ourselves. But here's the problem. Self-diagnosis is not the same as a professional diagnosis. Your headache might not just be due to stress, it could be a symptom of high blood pressure, a tumor, or a neurological condition. That stomach discomfort you've had for weeks might not just be indigestion, it could be ulcers, or even early signs of cancer. Taking over-the-counter pills without a proper diagnosis can hide the real problem, making it worse in the long run. One of the most common mistakes is using antibiotics without prescription. Many people believe that antibiotics can treat any infection, but this is simply not true. Antibiotics only work for bacterial infections, not viral ones like the flu or the common cold. Taking antibiotics when you don't need them not only does nothing for your illness, but it also contributes to a massive public health crisis, antibiotic resistance. This is when bacteria adapt to survive against drugs that used to kill them, making infections harder, and sometimes impossible, to treat. Another issue? Mixing medications without knowing the consequences. You may take a painkiller along with a cough syrup, not realizing that both contain ingredients that can affect your liver, leading to toxicity. Or perhaps you're using a herbal supplement while on blood pressure medication, not realizing that natural doesn't always mean safe, especially when combined with pharmaceutical drugs. Exploration and development of dangerous self-medication habits. Self-medication is more widespread than most people realize. While it might seem harmless to take care of minor health issues on your own, the reality is that many common practices can be dangerous, sometimes even life-threatening. Let's dive into the most risky self-medication behaviors and why they are a cause for concern. 1. Reusing old prescriptions. A lot of people keep leftover antibiotics, painkillers, or other medications just in case they need them later. When similar symptoms show up again, they assume the old medication will work the same way. However, this is a dangerous assumption. Health conditions change over time, and symptoms that look familiar might be caused by something entirely different. Taking an old medication may mask a serious problem, delay accurate diagnosis, or even worsen the condition. Furthermore, medications have expiration dates, expired drugs may lose effectiveness, and in some cases, they can become chemically unstable or harmful. 2. Adjusting dosages without medical advice. There's a dangerous mindset out there: if one pill helps, two will help more. People often increase or decrease doses based on how they feel, without understanding the risks. Overdosing can lead to organ damage, mental confusion, or even death. On the flip side, underdosing can render the medicine ineffective and allow a condition to worsen. Doctors determine dosage based on a patient's specific needs, things like age, weight, other medications, and medical history all matter. Ignoring these factors can lead to serious complications. 3. Mixing OTC drugs with alcohol or recreational substances. This is an extremely common but hazardous practice. Many people take over-the-counter medications while also consuming alcohol, cannabis, or other substances, without realizing the dangers. For example, combining alcohol with acetaminophen can severely damage the liver, while mixing ibuprofen with alcohol can harm your kidneys or cause stomach bleeding. The effects of recreational drugs combined with medications can be unpredictable and even fatal. What's worse is that most people don't read warning labels or consult a pharmacist before mixing substances. 4. Using herbal or natural remedies without supervision. The phrase natural remedies often gives a false sense of safety. People believe if something is natural, it must be harmless, but that's far from true. Herbal supplements like St. John's wort, ginseng, or garlic extract can interfere with a wide range of medications, including antidepressants, birth control, blood thinners, and more. Some herbs may increase or decrease the effectiveness of prescription drugs, leading to treatment failure or serious side effects. Without proper knowledge or guidance, mixing herbs and medications can be just as dangerous as pharmaceutical drug interactions. 5. Cultural norms and misinformation. One of the most overlooked reasons why people self-medicate dangerously is cultural influence and misinformation. Many habits are passed down through generations, like using old family remedies, copying what parents or friends do, or trusting what they see on social media. Unfortunately, these methods are often not based on science or medical understanding. Social media influencers and unverified websites can promote miracle cures or suggest treatments that haven't been tested. This creates a false sense of trust and encourages risky behavior, especially among younger people who are more likely to turn to the internet for answers. And here's the kicker: many of these self-medication habits are passed down through families or learned from friends. Cultural norms, home remedies, and social media advice often outweigh medical logic. The result? A generation of people unknowingly gambling with their health. Let me share a real story that might hit close to home. A young woman named Sarah, 28, started experiencing anxiety during the pandemic. Instead of consulting a doctor, she started taking some leftover Xanax pills from her mother's old prescription. She didn't understand that these pills could be highly addictive. Over time, she began taking them daily, then multiple times a day. Eventually, she became dependent and couldn't function without them. When she finally sought help, she was diagnosed not only with severe anxiety but also with benzodiazepine dependence, a condition that required months of rehab and therapy to overcome. Sarah is not alone. Every day, thousands of people walk this exact path. A minor health issue, a shortcut, a pill borrowed from someone else, and suddenly, you're facing a much bigger health crisis than the one you started with. So, what have we learned today? Self-medication may seem like a quick fix, but it comes with serious risks: misdiagnosis, delayed treatment, drug resistance, organ damage, addiction, and even death. Even seemingly harmless actions, like taking a leftover painkiller or mixing vitamins with prescriptions, can snowball into dangerous health outcomes. The truth is, your health is far too important to treat casually. Seeking medical guidance doesn't make you weak, it makes you wise. It's okay to use home remedies for mild issues, but for anything beyond that, talk to a healthcare professional. Get tested. Ask questions. Be cautious about what you put into your body. Now I want to hear from you. Have you or someone you know ever had a bad experience with self-medication? What do you think is the biggest reason people avoid going to the doctor? Drop your thoughts in the comments below. Let's start a conversation. And if you found this video helpful, be sure to like, subscribe, and hit the bell icon so you don't miss future videos on real, research-backed health advice. You can also check out my next video on the hidden dangers of mixing medications with supplements. It's a must-watch for anyone serious about their health. Remember, your body deserves real care, not guesses.